How do leaders empower teams when life disruptions hit suddenly? Your phone buzzes and a key team member says, "My mom had a fall, I'm at the ER." Or another person says, "My child's school just closed again." Or, "I need to step out now, it's urgent." No warning, no time to plan, just disruption. The question isn't whether these moments will happen. It's whether your leadership is ready when they do. If we haven't met, I'm Dr. Anna Thomas. I'm a physician, leadership speaker, caregiver advocate, and corporate wellness specialist. I help organizations strengthen their workforce and create workplaces where people and performance can thrive together. Even as we enter an era of AI, automation, and agentic teams, the future of work is still human, and that work is changing dramatically. But at the same time, employees are navigating complex personal and professional pressures that are only going to escalate in the coming years. For example, in the next 5, 10, 15 years, we will see an exponential increase in the number of older adults who will need caregiving support. Who will be providing that care? Working adults. Right now, 63 million Americans are caregivers. That's 1 in 4 adults, with more than half of them currently working full-time. Those numbers are expected to increase and will have a tremendous impact on our communities and, yes, even our workplaces. And caregiving is just one example of a personal stressor that will impact the workplace. Mental health, chronic illness, stress, and burnout are all on the rise, and the organizations that will thrive are those that lead with care, culture, awareness, resources, and empowerment. Care. Through this series, I share practical strategies, leadership tools, and insights to help you create cultures that support well-being, strengthen engagement, and retain top talent. If you'd like a clear starting point, then check out my free training, The Future of Work is Care. The link is below. And while you're there, be sure to like, subscribe, and share this with another leader who is ready to build a workplace that cares. Let's get into today's topic. Here's a truth that most leaders miss. The moment after an employee discloses a personal crisis, whether it's caregiving, a sudden illness, or a family emergency, that is a turning point. You either build trust or you break it. And how you respond doesn't just affect that one employee. It shapes how your entire team thinks about safety, flexibility, and belonging. Let's talk about how to get that moment right. And we're not talking about long planned leaves or known scheduling needs. We're talking about real life. ER or hospital visits, a last-minute call from a school or a care provider, a mental health crisis, a sudden loss in the family, a flare-up of a chronic condition. These moments are chaotic, they're emotional, and your employee is likely panicked, distracted, worried about their job, unsure how much to disclose, and your next move matters. Imagine this, your employee explains what's happening, they say they need to step away. They're emotional, but they're professional. You can either say, "We'll figure it out, take care of what you need," or you could say, "Okay, but we're really slammed right now." Same disruption, 2 different signals. In the first, your employee feels safe and seen. In the second, they feel like a burden. And that ripple effect can reach every corner of your team. Let's talk about what empowering leadership can look like instead. And you don't have to be perfect, but you have to be clear, calm, and compassionate. So here's what that means. Validate the situation. "Thank you for letting me know. I'm so sorry you're dealing with this." Then clarify the needs. "We've got this. Go be where you need to be." Set a simple check-in point. "Let's touch base tomorrow or next week to regroup." Mobilize the team. Let others know what's needed without oversharing. And model stability. This is what care looks like, and we have the systems to handle it. This isn't softness, it is readiness. So let's talk about what not to do, things that you want to avoid. Don't question the urgency. Don't question the urgency. If they disclosed it, it is serious. Why else would they be telling you about this? Don't pry for all the details. Respect their privacy. Don't use guilt. We're short-staffed sends the wrong message. But also don't delay action. Silence creates uncertainty. Don't assume it's a one-time thing. Sometimes these disruptions can signal an ongoing need for flexibility or more support. This moment is your doorway to understand what sustainable care can look like for your team. How do you prepare yourself before this starts? Empowering leadership doesn't start in the crisis, it starts before it. So here's how you prepare your systems and your culture. Make sure you have some plans in place, coverage plans. Cross-train your staff so no one individual is a bottleneck. Build life readiness questions into check-ins, like simple questions like, is there anything outside of work that we should plan around? How are things going? Is there anything that you need support in? Train your teams in sharing responsibility, so support isn't just a one-off favor, it's a standard practice that we support one another. And keep track of patterns. Who's had repeated emergencies? Who's quietly stepping back? Those points matter. When you do this, you move from reaction to readiness. If you want to lead well in these sort of circumstances, then I encourage you to watch my free training, The Future of Work is Care. You're going to learn how to build systems that support employees through life's disruptions without sacrificing outcomes. And if you haven't yet, check out my book, Workplaces That Care. It's available on Amazon. It is your playbook for building a resilient workplace that supports and retains top talent. Before you go, here's what most leaders don't realize. The moment someone says, I need to go, is the moment they're deciding whether to stay. They're watching how you respond, whether they felt guilted or supported, whether their team scrambles or steps up. And if you respond with care and clarity, they'll remember that, and so will everyone else. That's how you build not just flexibility, but fidelity, loyalty, retention, and trust. It doesn't take a perfect system. It takes a prepared leader. You've got this. In the next week, we're going to talk about how AI can amplify, not replace, human empathy at work. While you're waiting for that one, check out this video. What happens when leadership avoids talking about real-life challenges like caregiving? Remember, in this age of AI, the future of work is still human. So let's create workplaces that care together.